Hello everyone, this is a technique video presentation for the lateral hindfoot endoscopic anterolateral posterolateral leap subtalar arthrodesis. It is an effective, minimally invasive technique to achieve subtalar fusion. The leap approach for subtalar arthrodesis improves visualization and provides access to all facets of the subtalar joint to ensure adequate preparation of the opposing surfaces, and can also allow for coronal plane deformity correction of the hindfoot. Our disclosures are enlisted. Patient is anesthetized and a thigh tourniquet is applied on the operative lower limb. The patient is placed in a lateral decubitus position with the operative leg on top, supported using a sterile foam or bump with the foot hanging free. The leg is prepared and draped. We make use of routine arthroscopy setup and instruments for this technique. The technique is described under the enumerated 5 steps. This image provides a review of the gross and the arthroscopic anatomy of the subtalar joint. In the image, we can see the calcaneum with its 3 facets, anterior, middle, and posterior. First, we identify the lateral process of talus. Then, using it as a landmark, the subtalar joint is entered and the posterior facet is prepared till we visualize the flexor hallucis longus tendon. Then we identify and remove the interosseous talo-calcaneal ligament and expose and prepare the middle facet. Then we identify and debride the cervical ligament to expose and prepare the anterior facet. Fibula and the lateral malleolus are marked on patient's operative foot. The posterolateral or peroneal P1 portal is established using a 1.5 cm incision posterior to the lateral malleolus over the peroneal tendon sheath. Sinus tarsi P2 portal is established at the soft spot. Through the P1 portal, the peroneal tendons are retracted posteriorly and the arthroscopic sheath is placed anterior to them and pushed under the tip of the fibula deep to the calcaneofibular ligament to visualize the lateral endoscopic space. Through the P2 portal, a blunt trocar is pushed down onto the lateral process of the talus while visualizing it through the P1 portal. It is passed along the lateral subtalar joint line in order to develop the lateral hindfoot endoscopic space using blunt dissection. Arthroscopic shaver is then used to clear the soft tissues and gain better visualization. After debridement along the lateral subtalar joint line, the subtalar joint is entered and posterior facet is prepared till flexor hallucis longus tendon is identified. We need to switch the instrumentation and the viewing portal for adequate preparation of the posterior facet. As we move anteriorly, the interosseous talo-calcaneal ligament is seen. This is a tough structure and may need a sharp-edged scoop or curette for initial debridement and then a shaver to gain access to the middle facet which lies medial to it. After preparation of the middle facet, as we move anteriorly, cervical ligament is seen. Anterior facet lies anterior to the cervical ligament. This can be debrided by a shaver to gain access for visualization and preparation of anterior facet. We do not routinely prepare the anterior facet in isolated subtalar arthrodesis. We prepare it as a part of triple arthrodesis. To ensure adequate healing response, we perform microfracture of the prepared joint surface. We perform internal fixation using 6.5 mm partially threaded cannulated cancellous screws in vertically parallel configuration. These are the follow-up CT scan images of the patient demonstrating sound arthrodesis. This completes the technique video. Thank you.